Hello everyone, my name is Onyinyechi Udo. I am here to present my final project part 2, GPH 732 Community Assessment. Overview of the community assessment. Community health assessment entails a carefully planned process designed to choose communities that will deliver strategic outcomes in improving and promoting the health of the community. It is also a process that is used to identify the many assets and resources that are available and that can be proved to be used in promoting healthy living for the community. The usefulness of this community assessment is to mobilize the community and identify the skills and resources in the community to be used in developing a sustainable interventional program that will improve and reduce their priority health concern. My community for this assessment is Camden City, New Jersey. Camden is an urban city located between two waterways, the Cooper Rivers and Delaware. The city of Camden is known as one of the most violent and poorest cities in the United States of America. There are socio-economic and demographic variables that are identified for this assessment. The socio-economic variables identified are income and poverty. The city of Camden has been identified as a community of low income and poverty. And a poor community is a vulnerable population because they will be unable to attend to their needs. Housing is another socio-economic indicator used in assessing this community. Most houses in Camden are old. Some of the houses are stacked together in multiple units, and they make the environment overcrowded and dirty. Demographic factors identified are population and population density, race and ethnicity, age and sex. And this helps in community assessment by revealing the issue of concern in the community. The population of Camden City in 2017 is 253,400. The methodology used for this assessment is the windshield survey and interview. The objective of conducting this windshield is to obtain initial data of Camden City through driving. This is to determine access of Camden information to the community. The interview described the community's overall socio-economic to be so poor, and that demographic profile shows that there are more blacks in the community. The theoretical framework that was adopted for this assessment is the Mobilizing for Action Through Planning and Partnership MAP. And this was adopted as it allowed range of community engagement with the Camden City government, non-governmental organizations, public health care professionals, partners, community residents to collaboratively determine approaches that will improve every area of Camden City public health system. Using this map as the theoretical framework, the 6 steps of MAP was adopted, and these steps are organize for success, partnership development, visioning, assessment, strategic issues, goals and strategy, action circle. The action circle is the last step in the step, and it brings together the planning and implementation process in this assessment. The assessment also looked into the health profile of the community. The importance of public health profile is to provide health information, and the use of health information will help in making plans and taking decisions on ways to eradicate health inequalities and improve people's health in the community. The identified health indicators are life expectancy, The female life expectancy in Camden is 81, while that of New Jersey and the nation is 83 and 81 respectively. There was also absence of health insurance, which attributed to barriers experienced in the community regarding their health. Violence is also compared to the state and nation, and the violence rate in Camden is 563%. Other health indicators are social and mental health, smoking, motor accidents. Health priority for the community is cardiovascular disease. Cardiovascular disease was examined to be associated between socioeconomic factors in the community. The socioeconomic factors for cardiovascular disease noted that educational level is associated with hypertension, smoking, and high cholesterol. Lower socioeconomic population are subjected to cardiovascular disease. Age, sex, and race are the demographic characteristics associated with cardiovascular disease. Cardiovascular disease affects adults and also it cuts across all ages in Camden City. And African Americans are more prone to suffer from cardiovascular disease or heart disease. We also identified community assets and capability. Community assets are a collection of resources at the disposal of individual and community which can be leveraged in developing effective programs that will promote social inclusion and improve the health and well-being of the community. For instance, the designing and implementing of effective lifestyle modification on some health issues in a community such as diabetes, which has challenges due to contextual factors associated with the health outcomes, have been proven by some studies to be addressed by examining the patient's need to available community resources. The findings of this assessment identified that social and economic factors were the major determinants of the community health status. For instance, lack of poverty was found to have affected the health of the population and has caused a growing unmet need in the community. This assessment also observed strength of the community with an available education program that supports the community member. Recommendation and conclusion for this assessment as follows. The first recommendation is to reform employment services. This will allow jobs for the members of the community. The second recommendation is to implement programs and services that will encourage community participation. And the third recommendation is to implement policies that encourage health promotion. And overall, the assessment of these health factors, community resources, socioeconomic and demographic variables will help in developing policies and programs that will create a friendly environment that will promote health and well-being in the city of Camden, New Jersey.